I'm an analyst within the Digital Innovation Hub at Novo Nordisk. And today, as you can see in the top right corner, I'm going to be speaking a little bit more around how we view the importance of EHR integration when we're evaluating digital partnerships and how that's evolved. A lot of this has been spoken by our previous speakers today. I indicated that I'm not speaking to the mic enough, and I move my hands a lot, so I apologize. No, but a lot of what I'm going to be speaking about today has been really reiterated by all of our previous speakers. Hopefully this just really hammers home to everyone here the importance of these components and the fact that multiple different players in the space are really thinking about it. But to give a little background on the Digital Innovation Hub, just to give some context to the way I'm speaking through the rest of the presentation today, and I'll try to be quick, as I know everyone here is ready to go to a cocktail hour. But a little about the hub. So we're a U.S. branch of a global network of hubs across the globe, and we're each anchored within our individual markets. And our sole purpose and main goal is to really integrate digital partnership within the commercial colleagues' ways of thinking, the ways they think about addressing their different challenges. And on here I have some of our partnering capabilities and some of the things we consider when we're thinking about partnering. And as an analyst, I really help walk through our commercial colleagues through thinking through these different processes and really thinking about partnership as a foundation for digital transformation. And as I've been going through these conversations since we launched the US Hub officially back in April and I joined, one of the things that's really come up in a lot of the ways we've been thinking and evaluating this space is the intersection of digital solutions on the market and electronic health records. I think it's been reiterated by the past two speakers. This is not an easy task to do, but it really is a point in which we see differentiation when we're looking at partnering with different solutions. I think it's very well known that the EHR systems have revolutionized the healthcare ecosystem. They're really central. I think that this is a point that was mentioned earlier. They're central to the ways of operating, the way we treat health data. But they haven't really met their full potential, and this is, from our perspective, an opportunity, these digital health solutions, to really create a more optimal future when we're thinking about the utilization and the utility of electronic health records. Some of the general points here is more just speaking to the fact that a lot of the events that we're seeing are signaling an environment that really values data interoperability and values the ability for patients to go where they want to go, but still have access and still have their health records in a centralized location to really optimize their experience. So taking kind of a general step back, and I just want to touch on some of the challenges that we see in this space, and we're really tying it back into this area of digital solutions can solve it, but how can that additional lens of integrating with EHR data or within EHR systems can really help to optimize that solution. So as we heard earlier, patient experiences, patients are seeing themselves more and more as having a hands-on approach to their care. And we heard earlier, I think it was really well said that it's more of that life experience they want. It's about their healthcare experience. And because of that, they're going to spaces that are more comfortable to them to be able to monitor their own well-being. But that information is kind of becoming siloed from everything else that they have. And it's when we're thinking about these first two challenges around having to optimize the patient experience and have them be able to have access to all of their own medical records, we're also seeing these silos impacting the way providers are able to then work with those patients and really make informed clinical decisions with them. As we look at the third point here, it's been, again, something that's been spoken to, so hopefully it really iterates their idea around this fragmented care coordination, communication across different providers within a system, but even outside of separate systems, especially in that instance, the communication between them to really ensure that there is a comprehensive and integrated patient management experience for patients is lacking. And that component of, if you're a solution that can solve this problem, really being able to leverage the EHR data and integrate within them so it's an ease of experience for the end user is very important. And obviously administrative burdens remain, and they always will continue to be a big point. But again, as we think about from the EHR integration lens, this is an additional point where it can really be optimized. quickly going through here, moving from those challenges, there are certain innovation trends that we really see as having this opportunity to shape this future and optimize the EHR experience and what it can really be within the healthcare ecosystem, and really optimizing the utility of it. And I've listed them out here. I think the second and third one, it's been spoken about earlier about the kind of efficiencies of healthcare. These 2 points kind of touch on that, solutions and tools that make things more efficient. And it's very clear that leveraging EHR data or integration within EHRs are really important. But these are 2 innovation trends that we've explored and seen the greater value that this integration component can take. Something that wasn't maybe as apparent in some of our earlier conversations, though, is we're also seeing this within kind of the telehealth component and remote patient monitoring. If patients are using these other solutions where they're comfortable, how can that data then be easily communicated between a virtual consultation and an in-person consultation, and ensuring that, again, that seamless experience for patients. Care coordination goes back to that challenge previously mentioned, and kind of 2 components when we're thinking about this last bullet, but really one point that is been reiterated is this idea of point solutions and how there is a need to kind of integrate them and integrate the data and the information they're able to provide to create that seamless user experience. And we're really seeing these as trends that where integration with EHRs are really becoming more and more important in the way we're evaluating it. Speaking to here are some of those points that we think about for evaluation. Again, right, with this first point here, we're really seeing that EHR integration component, understanding, being the expert on what that means, how to do that from a secure perspective, is rising more and more as a distinguishing factor when we're evaluating partnership. But as we look at this third and fourth and second points, these are typical, kind of exactly what you think of when you think of evaluating for partnership. But when we add the lens of EHR integration, there's additional components that need to be thought about. When we think about consumer behavior, I think it's been mentioned earlier around fatigue of, point solution fatigue or click fatigue within the EHR. So when you're thinking about how you're integrating within the EHR, leveraging that data, really being super aware of your consumer behavior, your end user behavior, and being able to clearly communicate that with this lens. The same goes for the economic value and the scalability, even beyond just being able to say, what your plans are. Again, thinking of it from that lens of integrating within EHR, leveraging EHR data, or integrating within an EHR system. And then just to quickly tie us off here a little bit, partnership, I think, is, in our perspective, really a way to achieve this ideal future of an integrated healthcare system, really interconnected when we think of data and the way we think of patient experiences, really to improve patient outcomes. And in this perspective, partnership is really a way where we can leverage the capabilities, the expertise of each of the organization to really optimize how we achieve that future. And really, I guess to close it all off, the trends and the points that we've outlined previously are just something that our team is more and more looking into, more and more evaluating and exploring it as areas of interest. So obviously keep that in mind. And if you are an organization here that has thinks you can meet the needs and the things that we're thinking about, feel free to reach out, and I'm happy to have a conversation to learn more about this. Thank you.